this is gonna be that little hip shift thing that we do to kind of mobilize through that sacral area and activate that outer hip muscle that we worked on in the clinic today, okay? So what we're gonna be doing is we're gonna put elbows down on a surface that's hip level-ish, so that we can have a good flat back while we're doing this. You're gonna walk your legs back so that you're at kind of 90 degrees here. And we're gonna do this on both sides, but especially if you're hurting on one side or the other, you'll have that side with the straighter leg, and then the other one's gonna be bent, and the toes are gonna be down, heel is lifted up. So we're gonna be here. I'm gonna bring my right foot, if I'm doing my right side, forward just a little bit. I'm gonna come up onto my toes of the other side with my heel lifted. So my knee is bent on that side. My straight leg is not locked out, it's slightly bent. I'm gonna keep my legs parallel to each other as I go down into this movement, okay? So you're on something here, you're dropping that knee straight down to the ground, trying to just let this hip kind of drop down. And you can see I'm keeping my legs parallel to each other like they're on train tracks. And then to come out of this, I'm going to push through my toes and my heel of that straighter leg, pushing through it in order to raise this other hip up. And I'm doing this very slow. And then when I come back down, letting that knee drop down towards the ground. I'm taking some good breaths here. You should feel a little bit of a stretch through here. Maybe a little bit of activation. Sitting there, pushing through, and then you should feel through here. Push through the heel and the toes, pushing the world away, activating through here. And we're gonna do that about 3 to 4 times if you're trying to mobilize the pelvis. You're gonna do 2 sets of 5 to 10 if you're trying to strengthen those rotators and that outer hip muscle. Okay, so there's that little hip shift drop that we've went over in sessions.